Hello, and welcome to the Addiction Treatment Program at Resurrection Behavioral Health. We know that being a parent of a son or daughter who has an alcohol or drug problem can be very stressful and frustrating. So I've asked some members of our clinical staff to share with you some of the information that you will find helpful during this assessment and treatment process.
Teen drug and alcohol abuse are among the most common serious health issues we face in raising our children in today's world. The use of alcohol and marijuana over the past 10 years has increased, and the average age of first use has gotten younger and younger. In a recent survey of high school students, 62% admit they have been drunk. 31% admit to binge drinking in the previous 2 weeks, and almost 4% report using alcohol daily. 6% of those surveyed admitted daily use of marijuana.
It's important to note that street drugs come in widely varied strengths and often contain unknown agents that can be more harmful than the teen is aware of. For example, marijuana today is up to 10 times more potent than the marijuana that was available 30 years ago.
Prescription drug abuse has also skyrocketed in recent years. 19% of teens report that they have taken prescription drugs to get high. The most commonly abused prescription drugs include painkillers, such as OxyContin and codeine, depressants, such as Xanax, and stimulants, such as Adderall and Ritalin. Over-the-counter drugs, such as cough medicine, which contains a chemical called dextromethorphan, are also commonly abused, and a surprising number of household products are used to get high by inhaling them. Heroin and cocaine are not just inner-city problems. They are easy to obtain even in our suburban schools and neighborhoods.
We know that teens today are using drugs earlier, have more drugs to choose from, and tend to look at drug use as exciting and empowering. Even when there has been education about the harmful risks of alcohol, tobacco, and illegal drugs, there appears to be pressure and support for teens to experiment and join the excitement.
We know that alcohol is a legal drug, but not for the adolescent. We know that alcohol use among adolescents is considered a normal rite of passage.
Not all teens who use drugs and alcohol get into trouble, and some adults have come to accept that alcohol and drug experimentation are just a normal part of growing up. So why all the concern? Is it really that risky?
Studies show that almost half of the adolescents who drink alcohol before the age of 14 will develop a problem. This is compared to adolescents who wait until the age of 21, where the percentages are about 10% of that same population will develop a problem.
Recent brain research has shown that the human brain really isn't fully developed until a person reaches their mid-20s. The last part of the brain to develop is called the prefrontal cortex, which is the very front tip of the brain and is responsible for decision-making, planning, and emotional regulation. And you can think of it as where common sense resides in the brain. This part of the brain is particularly undeveloped in adolescents, which may explain why they can be impulsive and can use drugs and alcohol without any apparent concern for the consequences.
We know that the younger you are when you are exposed to drugs and alcohol, the more likely you are to experience problems with abuse or addiction. Other factors that increase risk include psychiatric problems such as depression or anxiety, lack of success in school with poor grades, and trouble establishing healthy relationships, a history of physical or emotional abuse, and a family history of addiction.
A child whose parent or grandparent has a history of addiction is twice as likely to develop problems themselves than the child who doesn't have this family history.
Risk of addiction is not the only risk. We know that alcohol and drug-related accidents are the leading cause of death in adolescents. Deaths from overdose have increased, and serious brain damage can occur from even the occasional use of inhalants. In the evaluation of an adolescent, we take all those risk factors into account as we do a comprehensive assessment.
As part of our assessment process, we collect as accurate a drug history as possible, in addition to a urine drug screen that tests for 9 chemicals, including alcohol.
In addition to the chemical history and the drug testing, we gather information from you and your teen to determine the impact of use on health, social and academic functioning, family relationships, and psychological functioning. Repeated use of a substance despite negative consequences is the basis for a diagnosis of drug abuse and dependence. After the assessment information is considered, you will be presented with a plan for further treatment.
Following the assessment, you will be given a recommendation as well as your teen. Some young people who are using drugs on a repeated basis, despite negative consequences, will be recommended the Intensive Outpatient Program, or IOP.
The Intensive Outpatient Program, or IOP, consists of 3-hour sessions 4 times each week and includes activities such as group and individual counseling, educational sessions, weekly family meetings, 12-step meetings, and random drug testing. Your child does not go through this process alone. Parental support is crucial to success.
If we have recommended the intensive outpatient program for your adolescent, we would like to provide you with as much support and direction as possible. The IOP program meets 4 times a week at the treatment center. In addition to that, we require 12-step recovery meeting attendance, such as AA and NA, and for the family members, Al-Anon and Families Anonymous.
We expect that parents provide the adolescent with transportation to the scheduled meetings in the intensive outpatient program. Patients are expected to attend 2 outside AA or NA meetings each week. NA meetings generally last about 2 hours. AA meetings generally last about 1 hour.
We strongly recommend that you make your home safer by securing any alcohol, over-the-counter or prescription medication that you may have. Teens are abusing both over-the-counter and prescription medication more these days.
Since the adolescent's peer group is an influential part of their recovery, we have found that it's important that the adolescent make decisions about limiting their interaction with their current using peers. It's important for the adolescent to look at and explore the possibility of developing new peer groups that have similar or common interests to the things that they like to do.
We ask parents to decide and to communicate what are their rules and what are the consequences if those rules are not kept. We may ask you to complete a home contract in order to better define those consequences.
In addition to the intensive outpatient program, there are 2 other options. A low-intensity educational program for problems that are less serious, and in some cases, residential treatment will be recommended where the adolescent lives at the treatment center.
If the problem is less severe or of shorter duration, a program called Teen Intervention Program may be recommended. It is 4 sessions once a week of both therapeutic and educational focus for you and your teen to explore their drug use problem. Some young people need to be separated from their school and their peer groups for a period of time in a residential treatment program for adolescents that we would refer them to.
While the process is sometimes difficult, addiction treatment can be very successful, and we see positive changes in our patients and their families. You are a crucial part of the treatment team. Make sure to ask any questions that may come up and be an active participant.
We know we have given you a lot of information in a short period of time, and you may feel somewhat overwhelmed at this point. The important thing is to trust that it will slowly get better and realize that this process takes time. Our job is to provide the support and tools for you and your family so you can enjoy a good and satisfying recovery from this illness. Thank you for your attention.
Adolescent services are available at 3 Chicagoland locations: Lake Bluff, Palos Heights, and Downers Grove.